This is the enlargement of gums that can happen with a commonly used blood pressure medicine called calcium channel blocker. This can happen in any age, can cause problems with chewing and speaking. This can be taken care of by temporarily stopping the medicine and switching to a different one. There are many different health problems that can easily show up in the mouth and teeth. Since mouth and teeth are easy to examine, it is important to know about these. Number 1 is diabetes, or simply known as high blood sugar. This is a super common problem. If you have diabetes, your body is either not making enough insulin or is unable to use the insulin that it is already making. If either of these happens, then too much sugar stays in your blood, causing high blood sugar, and it can also spill over in the kidneys into the urine and show up as urine sugar on a urine test. Over time, high blood sugar can cause serious health problems like heart disease, including heart attacks, changes in vision, kidney disease, and changes in the gums. In the mouth, diabetes can cause periodontal or gum disease. Specifically, there can be inflammation on the gums and damage to the surrounding bones. It is more like a two-way street. Diabetes can increase the risk of periodontal disease, and on the other hand, diabetes can get worse because of periodontal disease. Treatment of one problem can take care of the other problem. Number 2 is acid reflux. This is another common problem. Patients with acid reflux typically have heartburn. There can be bitter taste in the mouth, and in some cases, difficulty swallowing, bad breath, and teeth erosion. The stomach acid is an acid after all and is an irritant to the teeth. The teeth can become torn out and even yellow at times. Patients with acid reflux can also have sensitive teeth. Check this link above to see how to take care of sensitive teeth and enjoy the food you love. If your symptoms of acid reflux are bad and are not easily controlled with medicines like ranitidine or omeprazole, then it may be time to see a doctor. Acid reflux can also be a result of a bacterial infection called H. pylori or Helicobacter pylori. This bacteria is very easy to test in a lab, and if you end up having this infection, it can also be easy to treat with antibiotics for a few days. If the infection is not treated, there is a risk of developing stomach ulcers. Number 3 is an unfortunate problem that affects people of all ages. This is called leukemia, which is a broad term for cancers of blood cells. There are many different types of leukemias. In common language, this is frequently referred to as blood cancer. Patients with these type of cancers can have fever, chills, weakness, frequent infections, severe loss of weight that is not on purpose, enlarged lymph nodes. The liver can get bigger. The spleen can get enlarged. There can be pain on many spots in the body, easy bleeding through the nose, and red spots on the skin. In the mouth, leukemia can present with bleeding in the mouth, ulceration, and enlargement of the gums, as you see here. Number 4 is the teeth changes seen in a condition called bulimia. Bulimia is a health condition where patients have a problem with their body image. They tend to eat a lot more than they should, and then the guilt of overeating sets in. Once this happens, the feeling of losing weight comes in and they intentionally puke or vomit. The vomit comes along with the stomach acid, and like acid reflux can affect the teeth. Because of continuous exposure to the acid, the teeth slowly erode and become sensitive to heat, cold, or sweet. These patients can also have an increased risk of caries or tooth decay. The next thing is lead poisoning. This is a problem that is unfortunately common in many parts of the world. You can check a video on lead poisoning in the description below to learn more about this and how to prevent this. In short, lead poisoning causes loss of appetite, constipation, and iron deficiency anemia. A blue line can develop on the gums with lead poisoning. This occurs because lead reacts with oral bacteria that are normally present and can produce this blue line as a reaction. This blue line can also be seen in patients with poor oral hygiene. Number 6, the blood has small colorless particles called platelets or thrombocytes. This is responsible for normal clotting of blood, which happens after an injury. The platelets can go down in many different health conditions like cancers, infections, and immunity issues. In many cases, low platelets may be detected because of changes in the mouth. If there is a trauma or injury in the mouth, like biting of the tongue, this may cause different types of lesions called petechia, purpura, or a hematoma formation. People with low platelets can also have bleeding in the mouth with minor trauma and sometimes with no apparent reason. Number 7 is another unfortunate problem. Cancers in other parts of the body can go into the mouth, and this can be a last stage for some people. In this example of an 85-year-old man from Japan, a cancer in the lung is progressed to spread in the mouth. This patient had a type of cancer called adenocarcinoma of the lungs, along with spread of cancer to the brain and abdomen inside the pancreas and kidneys. Subsequently, there was a rapid growth of this oral lesion over a 2-week period with bleeding and pain. Then the tumor rapidly progressed with a fatal outcome. Any suspicious lesion in the mouth requires a prompt biopsy. Number 8 is the enlargement of gums, which can happen with a commonly used blood pressure medicine called calcium channel blocker. This can also happen with other medicines like phenytoin, used for seizures, and a medicine called cyclosporin A. This can cause problems with chewing and speaking. If this happens in younger people, there can be a delay in tooth eruption. This can be taken care of by temporarily stopping the medicine and switching to a different one in consultation with the doctor. Sometimes a surgery may be required to take care of this. The pictures in the video are from scientific publications. We have left the source of figures with a link to the original article in the description below. If interested, you can always click on the link to learn more. If you have questions about your dental health or this video, post in the comments below. Don't forget to hit that like button. Smash the subscribe button to receive updates on contents like this if this type of content provides value to you. Take care and stay safe.